Hello everyone, I am Nurse Patience. Welcome to my YouTube channel. If you have not subscribed to this channel, please kindly hit the subscribe button, and if you are yet to like my video or drop a comment, please do that in the comment section. So today we'll be talking about hypertension, and under this outline, first definition, the categories of blood pressure, the signs and symptoms of hypertension. We'll talk about the types of hypertension, the risk factors to developing hypertension, and then the management of hypertension. The definition of hypertension. Hypertension can be defined as a sustained elevation or increase in the pressure or the force exerted by the blood against the walls of the arteries. The categories of blood pressure, we have the normal, we have the elevated, we elevated blood pressure, we have the hypertension stage 1, then we have hypertension stage 2, and we can also have the last one, which is the hypertensive crisis. So for a normal blood pressure, we have a systolic that is less than 120 and a diastolic that is less than 80 millimeter mercury. For a normal blood pressure, it is less than 120 over 80 millimeters mercury. While for an elevated blood pressure, you have a systolic that is 120 to 139 all over a diastolic of less than 80 millimeters mercury. Then for a stage 1 hypertension, we have a diastolic of greater than 140 to 159 millimeter mercury, and a diastolic of 90 to 99 millimeter mercury. Then for the stage 2 hypertension, we have a systolic of 160 or greater than 160 millimeter mercury, and a diastolic of 100 and greater than 100 millimeter mercury. Why the hypertensive crisis is when we have a systolic of greater than 180 millimeter mercury and a diastolic of greater than 120 millimeter mercury. And at this point, you have to see a doctor. It is a must. You need to go see a doctor. Then the next thing, we'll be moving on straight to the signs and symptoms of hypertension. Basically, hypertension does not have a particular sign or a symptom attached to it, but some individuals may come presenting with chest pain, headache, visual problem, tinnitus, that's ringing in the ear. Some will come with bleeding of the nose. So these are some signs that may be particular to individuals. The next thing now we'll be talking about is the types of hypertension. We have the primary and secondary hypertension. The primary hypertension is also known as the essential type of hypertension or the idiopathic hypertension. By that, I mean that this is a type of hypertension in which the cause is unidentified, while the secondary and it is the primary hypertension is the of hypertension. Then for the secondary hypertension, it is usually related to a particular disease. It could be a kidney problem. It's usually an underlying disease that causes this, or maybe some sort of medication the individual is on that is making the blood pressure to increase. The risk factors for developing hypertension. These risk factors are factors that would predispose an individual to having hypertension, and one of it is age. The risk for developing hypertension increases with age. Some individuals tend to come down with hypertension from the age of 40, while some will notice at 45, some 55, some 65. But usually, hypertension risk increases with age. Then the next is race. It is more common in Africans and Black Americans. The next is use of certain medication. Some individuals that are on certain medication would attempt to come down with hypertension. Example is use of oral contraceptive, and those people that are on amphetamine attempt to come down with hypertension. Another risk factor for developing hypertension is family history. If you have a member of your family with hypertension, then the risks of you or such an individual getting hypertension increases. Another risk factor for developing hypertension is sedentary lifestyle. Those people that are less inactive, that don't want to move around and stress around or do little things, they tend to come down with hypertension. Then also stress can also make an individual come down with hypertension. Depending on your kind of work, the stress level increases, and when your stress level is increased, there is a high risk of you coming down with hypertension. Then another risk factor for developing hypertension is heavy drinking. Those people that drink alcohol heavily, they tend to come down with hypertension. Another risk factor for coming down with hypertension is obesity. Those people who do not maintain a healthy weight gain, they tend to come down with hypertension. Also, the next thing, I'll be moving straight now to the management of hypertension. But before I go to the management of hypertension, how you can simply diagnose yourself or an individual of hypertension is by checking the person's BP. You can either use a digital monitor and BP monitor, or you can use the manual now that has a curve using a stethoscope and a sphygmomanometer to check the person's blood pressure. And this has to be done like 3 times before at different occasion now, before you can clearly ascertain that that individual has hypertension. So the management for hypertension, when we talk about the management, I will just draw your attention back to the risk factors. Those risk factors, if you have any of the risk factors, those things can be curtailed and well managed. And if you can properly manage the risk factor, then the risks or your chances of developing hypertension becomes very slim. For example, if you are a type that uses tobacco and you quit using tobacco, that means your chances for developing hypertension reduces. If you smoke, you quit smoking, it reduces your chances of developing hypertension. Heavy drinkers, you quit or you limit the number of alcohol you take. Then you eat healthy. By eating healthy, there is what we know as DASH, which is dietary approach to stop hypertension. Under this dietary approach to stop hypertension, you are cutting down sodium, high sodium diet, you are taking it out. You are also taking out high cholesterol containing food, those fatty food you really enjoy. You are going to take that out in order to have a good blood pressure. Then another thing is you will be embracing more of fruits, more of vegetable, and more of grains. So these are what you'll be living on basically in order to maintain a healthy blood pressure. And it is one major way of maintaining hypertension. Then another way of maintaining hypertension is also to stay off those drugs you are taking. For oral contraceptive, you can also try to reduce or you quit taking those drugs. Amphetamine, cocaine, and also caffeine. You can cut down your caffeine intake in order to have a good blood pressure. Then you can also check your blood pressure regularly to also help you maintain and keep track of if your blood pressure is increasing. Also, you increase your physical activities. By increasing your physical activities, I mean you should try to ambulate more. You try to walk. You might have a car, but there are times you might just decide to take a short walk, and this will really help you. Please, I would like to go. I would like to do a quick summary of what I've taught from the beginning of this video. I started by the definition, which I said that it is an increase in the pressure or force exerted by the blood against the arterial wall. Then the categories I spoke about: normal, I spoke about the elevated blood pressure, I spoke about hypertension stage 1, hypertension stage 2, then the hypertensive crisis. Then I also move further to say that the signs and symptoms of hypertension, there are no particular types and symptoms, but individual might come with symptoms that are specific to them. Then the types of hypertension, where I mentioned primary and secondary, which is essential and non-essential in another way of classification. The primary, I also said, is known as idiopathic. That's the cause is usually unknown. Why the secondary can be due to adrenal tumor, it can be due to obstructive sleep pattern, it can be due to certain medication, it can be due to thyroid and parathyroid diseases. Then I also move further to talk about the risk factors. Here I mentioned age, race, drug, alcohol intake, I mentioned physical activity, I mentioned obesity, I mentioned diets. When you take, also to add to the risk factors, diets that are low in vitamin D would also increase an individual chance or risk now for developing hypertension. Another of it is low potassium diet can also increase an individual risk for developing hypertension. Then when I spoke about the management, basically management is about linking what are those risks now. How can you manage those risks? How can you upgrade those risks? If you're on a high weight gain, then you try to maintain a healthy weight gain. Then if you are the type that like cholesterol, high cholesterol or fatty diet, you try to cut them down. If you like high sodium diet, you try to cut them down. And also, if you're the type that don't like physical activity, you try to be more active physically by exercising, doing some walking around. Then also, you quit smoking, you quit some of those substance abuse, cocaine, amphetamine, caffeine, you try to quit them. I hope this video have been helpful to you. Please, if there's anything you'd like to share, I would like you to drop them at the comment section. Thank you.